So, like I mentioned, this presentation is going to be in regards to the measles disease and also the vaccination for the measles. So, objectives for this presentation are to discuss the basic gross and functional process of the measles disease and have an understanding of its background. The cognitive, affective, cognitive, and psychomotor are from Bloom's taxonomy, which is a learning module. You guys don't really need to know it. You can look it up if you want to get more into it. Other objectives are students will be able to summarize a nursing role for treatment of patients diagnosed with the measles disease and discuss their own views. Students will know the importance of who should receive the MMR vaccine and the contraindications to the vaccination. And lastly, students will show their understanding of material by taking a pre- and post-test. So the outline for the presentation is the introduction, pre-test, and personal opinions, a brief history background of the MMR vaccination. We're going to review who should receive the vaccine, contraindications of the vaccine, have a conclusion, and then lastly take the post-test. So introduction and personal opinions. Who in here believes that vaccinations are great versus who thinks that vaccinations should not be given? Anybody think that they should not be given? Everybody thinks that they should be given?
Yes.
Yeah? Okay, cool. So measles is a childhood infection caused by a virus. Once quite common, measles can now almost always be prevented with a vaccination. That's why they're highly recommended. Also called rubeola, measles can be serious and even fatal for small children. While death rates have been falling worldwide as many children receive the measles vaccine, the death still kills more than 100,000 people a year, most under the age of 5. Measles signs and symptoms appear around 10 to 14 days after the exposure to the virus. Signs and symptoms of measles typically include fever, dry cough, runny nose, sore throat, inflamed eyes, conjunctivitis, tiny white spots with bluish white centers on the red background found inside the mouth on the inner lining of the cheek, also called Koplik spots, and there's a picture at the bottom left of that, and a rash made up of large flat blotches that often flow into one another, which is on the other side. And the treatment for this is a lot of it is symptom management. So you're going to treat the fever, help treat the conjunctivitis, and so on and so forth. So background of the measles and the MMR. In 1912, measles became a nationally notifiable disease in the United States, requiring U.S. health care providers and laboratories to report all diagnosed cases. In the first decade of reporting, an average of 6,000 measles-related deaths were reported each year. In the decades before 1963, when a vaccine became available, nearly all children got measles by the time they were 15 years of age. It is estimated that 3 to 4 million people in the United States were infected each year. Also, each year, among reported cases, an estimated 400 to 500 people died, 48,000 were hospitalized, and 1,000 suffered from encephalitis, which is swelling of the brain, all due to measles. In 1954, John F. Endres and Dr. Thomas Peebles collected blood samples from several ill patients during a measles outbreak in Boston, Massachusetts. They succeeded in isolating measles in a 13-year-old patient named David Edmonston. In 1963, John Endres and colleagues transformed their Edmonston B strain of measles virus into a vaccine and licensed it in the United States. By the year 2000, it was said, according to the CDC, that measles was completely eliminated from the United States. So who should receive the vaccine? Measles can be prevented with the MMR vaccine. The vaccine protects against 3 diseases: measles, mumps, and rubella. MMR vaccine is given later than other childhood vaccines because antibodies transfer from the mother to the baby and can provide some protection from the disease and make the MMR vaccine less effective until about 1 year of age. The MMR vaccine is very safe and effective. 2 doses of MMR vaccine are about 97% effective in preventing measles, and 1 dose is about 93% effective. So you need 2 doses of the MMR vaccine, and they're usually given 3 months apart. Okay, and like we said before, the MMR vaccine is a live vaccine that's given subcutaneously. So contraindications of the MMR. Scientists in the United States and other countries have carefully studied the MMR shot. None has found a link between autism and the MMR vaccine. I know a lot of people in the community are concerned with vaccines and how they are related to autism, but studies have shown that that is not the case. Side effects of receiving the MMR include a sore arm from the shot, fever, mild rash, temporary pain and stiffness in the joint in which the vaccine was administered, and an allergic reaction. That's why with this vaccine, because it is a live vaccine, it does sting like a bee. So we try to give it in the arm that the patient usually does use, even though you would think it's the opposite, just so they use it and the arm doesn't stiffen up. If they have any severe life-threatening allergies, it would be a contraindication. If somebody is pregnant or think they might be pregnant, that's also a contraindication because it is a live vaccine. If they have a weakened immune system due to disease such as cancer, HIV, AIDS, or if they're on any immunosuppressive medication, again, because it is a live vaccine. If they have recently had a blood transfusion or received other blood products, you might be advised to postpone MMR vaccination for 3 months or so, or have gotten any other vaccines in the past 4 weeks. Live vaccines given too close together might not work as well. And these are the references. Thank you. Any questions? Yes.
You said they don't give it to pregnant women, but my daughter-in-law, when she was a few months pregnant, she hadn't had it because she's from France, and they gave it to her when she was pregnant.
So how long ago was that?
That was, the baby's 5 months old now.
So I think it might be due to the outbreak. They're kind of weighing the risk versus benefit, and that's up to the healthcare provider. But the CDC recommends not to give it to pregnant women because it is a live vaccine. But now with the current outbreaks that we have had, throughout the nation, they're kind of weighing.
I was kind of surprised that they gave it to us.
Yeah.
I had it when I was pregnant too.
Did you?
My
Okay.
doctor gave it to me.
So it's up to. Additionally, it's like up to the healthcare provider, but ultimately it's up to the patient if they want to get it or not get it. And working at a hospital, a lot of hospitals now require the employees to get it. They can't decline it. The only one that you can decline, I believe, is like the Hep B, depending on the hospital policy. But the MMR vaccine is not a requirement.
Hospital is right.
Mm.
It's been in the OBGYN. He's the one who gave it to me.
I don't know.
So even if
Yeah.
you're immune, you have to get it.
So if you have 2 documented doses of receiving it, the hospital will count that as you have received it. Or if you get titers drawn and you're positive for all 3, then you don't need it. If you're negative for the mumps, you'll need still the 2 doses. If you're negative for just rubella or rubella, you'll just need 1 MMR vaccine. Okay, and we'll go ahead and take the post-test.